I want to welcome everybody, and it's always a pleasure to be able to bring this to you once a month. Here we are. It is the third Tuesday of February. This is a year ago. February of 2020 was the last in-person presentation that Harrisburg Lyme did. My name is Eric Huck. I'm a co-founder and a board member of PA Lyme. I also am a regional leader of the Harrisburg, Pennsylvania support group. For those of you not familiar, PA Lyme has 17 support group regions, all run by volunteers who hold monthly meetings. And of course, we have not done anything live for now coming up on a year. We do have 4 of our regions that are running virtual monthly meetings, and we're going to start making those more available to everybody that's in our database. I'm pretty excited tonight to have Dr. Tom Moorcroft. Dr. Tom is a new name to me. He was introduced to me by one of our support group leaders out of Montgomery County. And through our due diligence and our homework to vet our speakers, I really learned to appreciate where he's coming from. Before I touch on really his background and his bio, just want to give everybody some recent updates. Last month, we talked about what was going on with legislation in Pennsylvania. We talked about some of the updates that are going on with the RICO lawsuit, just a lot of stuff that is going on that's moving the needle in the proper direction of Lyme awareness and really the Lyme reality that we all face. But most recently, this past month, maybe you noticed the CDC came out. They're increasing the number of infected cases of Lyme. It was 300,000 previously, and recently it was just pegged at 476,000. Where the CDC gets that number is they look at insurance claims. They look at the actual claims-based, and then they use a multiple, a factor of 10, to increase that number by. And if you've been around the Lyme community a while, you know that for years and years, the CDC was saying only 30,000 people in America have Lyme disease. And we used to throw our arms up because we think we have 30,000 in our neighborhood. It's just incredible how prevalent that it is. And then the CDC came out and they did a factor, a multiple of 10, which brought it up to 300,000. Well, recently, just as I said, based on insurance claims history last year, it's 476,000. There is a really interesting Zoom presentation that you can go and pick up. If you go to the LymeDiseaseAssociation.org, Dr. Bransfield did about a 2-hour presentation along with Pat Smith, who is the founder of the Lyme Disease Association. And it's very fascinating where the numbers come, who's on the IDSA, why do they get to pinpoint the number of cases, and just that background information was really very, very interesting. So what I think is interesting, if you look at the CDC notice, they insert a piece of information where they say, well, in that number, it might be overstated because in that number are probably people that are being treated that don't have Lyme. We think it's 100% opposite of that. We believe that number is significantly higher because there are probably way more people with Lyme and who are treating with Lyme who haven't made a claim to their doctor, to the CDC, to their insurance company. So we think that number is actually an awful lot higher. You're going to notice tonight that William Moore is a co-facilitator. Bill is on the board of Pennsylvania Lyme. He also runs the Pittsburgh Lyme Support Group. He is our director of technology, and thankfully for him, he's going to really be co-hosting, and then ultimately he's going to be ending this presentation. So here's how this will work tonight. If you have questions and you're on Zoom, you can take your cursor, go to the bottom of the screen, below the bottom speaker, and you can go ahead and ask your question. We're going to ask you to refrain from the chat and only use the questions. You can also, if you take your mouse and you're not familiar with Zoom, you can put it to the upper right-hand corner where your picture is, and you can reduce the screen to just one speaker, all of the panelists, none of the panelists, so you can control your visual experience. So if you have any questions, go ahead and type them in Zoom. Same thing for those of you that are on Facebook, for those of you live streaming, just normal. If you just post a question, Bill will capture all of these, he'll organize them, and at the end of the session, he will then ask the questions to Dr. Tom. He's going to look at really the more important questions. He's going to look at the questions that really impact more of the global audience and try to get it to be more of a general community type of question. So with that, I just want to do a slow introduction here of Dr. Tom Moorcroft. He has been practicing medicine since 1995. He was learning and then teaching wilderness medicine, worked on an ambulance, worked in an emergency room, worked really in a nursing capacity, became a doctor of osteopathic medicine from the University of New England College of Osteopathic Medicine. He believes that he treats some of the sickest, most sensitive patients suffering from chronic illness and chronic Lyme disease. This includes co-infections, which will be a big part of tonight. This includes mold. This includes infection-induced autoimmune encephalitis, things like PANDAS, things like PANDAS. So he believes he's treated over the last 12 years, just simply thousands and thousands of patients. What I appreciate about Dr. Moorcroft's his integrative approach is that he really tries to optimize the body's self-healing systems to achieve an optimal health balance, really looking at the patient's mind, body, and spirit, and try to bring the patient into a personal unity with all three. You'll know this because look at tonight's presentation. It's co-infections to start, and then we're ending with how to get a healing mindset. Both of those are 2-hour presentations. We're collapsing something that's really kind of a fine-tuned aspect of Lyme and tick-borne disease co-infections, but we're ending it with mind, body, and a healing spirit. So he is a member of ILADS, trained under Dr. Hurwitz and Dr. Ray Jones, and Dr. Moorcroft, really from PA Lyme, and certainly Bill and I. Thank you very much for participating tonight, and I'll turn it over to you.
Awesome. Well, thank you so much, Eric and Bill. This is a great opportunity. I'm so pleased to be able to have this time to talk tonight and do this conversation. So I guess we can just dive right on in here to the little screen share. And I really appreciate the intro because it really kind of sets the stage for where everything is at, the sort of the background of where we are. And as part of this whole thing, I really think it's important to understand where I came from. And I, back about 13, 14 years ago, actually it's probably longer, almost 20 years ago now, got Lyme disease acutely. I found out because I had a lot of brain fog and fatigue. I almost got fired from my job because I wasn't getting my work done. I developed this huge rash. This is back when we had rotary telephones. I was on the phone with a friend of mine and I couldn't remember my phone number to give them so they could check on me because I had called them. And I was actually staring right at the rotary phone where they used to write it on there. And I had no recollection that that was my phone number, even though I was only a couple feet away. And, ultimately I was treated for Lyme disease for about 10 days with doxycycline. And those first 4 days, I really laid on the floor and I was in excruciating pain, lots of sweats and chills, alternating, kind of freezing cold and super hot, despite it being July. And, one of the things that ended up happening was I kind of got better, more or less, right? And then over the next 8 years, I had all these things creep in, crappy mood, irritability, brain wasn't working, everything kind of hurt. I got diagnosed with everything from, depression to bipolar depression to ADHD. And for anybody who knows me, ADHD is probably the only one that was like a real diagnosis, but I view it as a superpower, not a problem. But that was what I always was. So I'm like, that didn't really explain what was going on. Ultimately, it became fibromyalgia and chronic fatigue. And I was pretty much, just laying around, not able to do anything. But as part of my healing journey, I knew that I needed to do something in my future. I knew that I had goals. I wanted a family. I wanted to play outside. I wanted to do all these things. And as I focused more and more and more on what I really wanted to accomplish, despite not having a doctor in my life who could help me understand what was wrong, and just they all told me it was up here in my head, I started to bring in the opportunities to heal. Ultimately, I was about 70% better when I met the doctors who finally gave me a diagnosis of Lyme disease that was chronic. But not only that, when I was shaking and sweating and freezing and in pain on the floor, they had missed the fact that I also had babesiosis. So I had 8 years of undiagnosed, untreated babesia, which, as many of you may know, could actually be life-threatening. So it was a scary realization, but I was very thankful because after that, after I knew what the diagnosis was, I'd gotten myself 70% of the way there. I had a team around me who helped me get the other 30% of the way. Then I was able to go from not being able to do much of anything to being able to do this the other day. And for any of you who have gone out skiing, this is Cirque Bowl in Snowbird in Utah. And the thing is, this is pretty steep. And because I like to be crazy, I do things like telemark skiing. And the bottom line is, this is not something I could have done 13 years ago. But this is what my heart wanted. And so by focusing on what I wanted, I was able to actually change that and create an opportunity for healing. And maybe your goal isn't skiing down Cirque Bowl or dropping in on some very near vertical slope. But the point is, you can have what you want when you're focused on it. So tonight, I want to, as Eric had mentioned, we're going to focus on co-infections. I want to talk about the prevalence. Definitely, when you talk about Lyme, we look at the big three: Lyme disease, Babesia, Bartonella, and we're going to focus in on those. And then we're going to talk about the new emerging treatments, particularly for some of our persister forms, because this is some of the most important research that's coming out that's really in the last 18 months been game-changing for patients who are suffering. I didn't have this benefit back in the day, right? And just so you know, with that little skiing video, I've been asymptomatic for over 10 years. So for me, I'm pretty sure it's gone. But the point is, now we can get there quicker. It took me 4.5 years after I met those doctors to get better. So I was struggling for 8. Those last 2, I started to make some movement, and then I had 4.5. So 6.5 years of getting better is way too long in my book. So tonight we're going to focus on the things that you can start thinking about to help you move forward. And then also, I want to let you know about the secret of how I was able to harness the power to heal. And placebo is part of that. We all hear about it. Placebo effect is 1/3 of all medical and surgical outcomes. The problem is, what people don't tell you is it's haphazard. It's positive, it's negative, it's neutral. I'm going to teach you how to make it positive. And I'm going to teach you how to go from 33% all the way up to that 60, 70% that I got, so that when you start plugging in all this knowledge about co-infections, you're going to just see rapid results. And one of the things I do want to point out, and what Eric was saying at the top of the hour here, this is a study that came out of Alison DeLong is studying over at Brown University. This came out in 2019. And if you look down here, we're able to see that the estimated number of people with post-treatment Lyme disease syndrome at the end of 2016 was about 1.5 million people. Now, the other part is, by the end of 2020, they think it was going to get up to almost 2 million people. I would suggest that the vast majority of these people who have post-treatment Lyme syndrome are actually having chronic Lyme disease. So it is something that, to really think about, that we have evidence that this is real. John Alcott is a researcher at Johns Hopkins who looks at post-treatment Lyme syndrome. They are finding this is a real thing. Some people think there's chronic Lyme. Some people think there's some other autoimmune condition. I think there's probably a mixture of all of these things. So keep your eyes and ears peeled for all this new research. But the thing I want you to all know is this is real. You are not making this up. You know, I'm sure there's a few people out there amongst the millions who are suffering who might be, you know, kind of overdoing it. But for the vast majority of everyone I've ever met, they are suffering with real disease, and the evidence is supporting that. So hopefully we'll start to see those numbers continue to reflect that. And one of the ways that we can do that is to actually look at what is in these ticks, because one of the problems is we get bitten by a deer tick or the Ixodes scapularis tick, also known as black-legged tick. And the problem is we're saying that, hey, people are getting Lyme and that's it. But when we look in here, we can see that many, many, many different infections are inside of ticks. If you look at Borrelia miyamotoi, I published for the first 24 cases in the United States, and these were among the first 73 in the world. And we didn't even admit it was a human pathogen until February 2011. Problem is, we can go back to 1992 now that we believe it's a human pathogen and find it in people. So the issue is, when we used to tell you it was all in your head, you didn't have Lyme, we were partially right. You didn't have Lyme, but you had Borrelia miyamotoi. And then we look here, this rickettsial infection, 65% of the deer ticks have it. We're telling people that's not a human pathogen. But that's what we used to say with, Ehrlichia murus-like. But now we're saying, oh, that's a real infection. We've got Babesia microti, we know that's a real one. But what about this one? Maybe in another year or two, we're going to say, oops, we forgot. This is a human pathogen. So same thing, we have a nematode here. How many people with chronic Lyme disease have found benefit from an antiparasitic protocol? Potentially, some of these things that we say are benign really aren't. So we're finding them in ticks. One of the things that you didn't see on that last slide was the presence of Bartonella in New York and Connecticut. However, when you look at this study out of Dr. Breitschwartz and Dr. Magi's lab, we're seeing that depending upon where in the United States you look, we have varying levels of infection with Borrelia. So if we look across the country, we're finding 13-14% of the ticks have Lyme, and about 2.5% have Bartonella henselae. But if you go to North Carolina, wow, we've got 63% have some sort of Borrelia species, and upwards of 10% have Bartonella. We can actually go back and we can look in 2004, Adelson said in New Jersey, they found 33% of the ticks had Bartonella species in it, as well as 33% had Lyme disease. So we do have different researchers finding different things, but the more we study it, the more we start to see there's pockets in the United States where you're going to get bitten by what appears to be the same type of tick, and you might get a different infection, or you might have a higher risk of another infection. Really important to keep your mind, keep an eye on that. Briefly, I wanted to go over some of the symptoms, because babesiosis is one that comes up very commonly. And I highlighted a lot of the symptoms. The reason I put some in black are because I want you to be able to remember very easily. So any of those really highlighted, bold, black ones are going to be ones that are going to be impregnated in your mind. You're going to remember those, right? So we're going to have sweats, day or night sweats. A lot of people talk about air hunger, that inability to get a full breath in. Now, it's not exclusively babesiosis, but very commonly we're going to be looking in that area. Rib pain, bone pain, sharp shooting pains are felt to be related to Babesia because it's a parasite that lives in your red blood cells. Within the bone marrow where we're creating the blood, that's might be why we're seeing a lot of these symptoms from Babesia. Now, with the headaches, a lot of times Lyme will cause all kinds of sort of more normal headaches and sometimes very intense, but it's more of your head wants to explode, or if you have anaplasmosis, it's more of an ice pick. With babesiosis, we've got like a tight band around our head. A lot of people will experience that head pressure. So some of these dark ones are just ones that might make you think Babesia, because oftentimes when we're treating Lyme, we're treating Bartonella, we don't see Babesia as a pathogen in the beginning. And then the issue becomes over time, we find out that actually this is the thing that's holding us back. This is what held me back personally. And so I was just so relieved when I got that diagnosis. Other things, you look at the first couple, myalgias, arthralgias, brain fog, numbness and tingling, fatigue. These things sound like Lyme, right? And Bartonella and mold exposure, and working too hard, or playing too hard, as I did this weekend. So things to really think about, though, is there's a lot of overlap. Depression and anxiety in Babesia tend to be a little bit on the higher side. Now, you can have depression and anxiety related to other things, but in babesiosis, that might be one that, you know, higher, you know, more amplified than you would expect. Same thing, dysautonomia, where we have a lot of people that can't regulate their heart rate. They have POTS. They've got irregular heart rate. We can see a little bit of this in Lyme disease. We see a lot of it in babesiosis. And conveniently, babesiosis and Lyme disease come from the bite of the same deer tick or black-legged tick. So a lot of times we're going to get more than one thing. So co-infection is common. And we have to think when we're finding this dysregulation of the autonomic processes, and this could even be constipation, we have to think about babesiosis. One of the things I want to point out with babesiosis too is, because we're going to be diving into some treatment in a minute, but one of the things is we typically are thinking about treating with atovaquone, a lot of people know it as Mepron, and azithromycin. The problem is that's our typical treatment for Babesia microti. As we've seen clinically for close to a decade now, Babesia duncani does not appear to be very susceptible to those medications. This study out of Yale in 2018 showed that basically they're finding the same thing we see clinically. And this is what you see a lot of in Lyme disease. You see that people, physicians, other healthcare practitioners, and patients are finding things clinically that 5, 10, 20 years down the road, we're able to find the scientific literature to support. So right here, we just want to think about it and we say, hey, the data suggests that the treatments typically don't work. So instead of using atovaquone and azithromycin or clindamycin and quinine, we're looking at more things like Artemisia, especially like whole plant Artemisia annua, or you can use artemisinin in the liposomal form. Cryptolepis is another one that's good in babesiosis, and we're going to be talking about both of these a little bit later. So it's really important to understand that not all of the Babesia species and not all of the other species in the tick that start in the same genus actually respond well to the same treatments. So very commonly, what I'll end up doing is if I have a Babesia microti, I may use these two herbs. I then have to back in sometimes to some azithromycin or maybe malarone, which is atovaquone, and another antiparasitic called proguanil. But all of these are really important to understand that the medicines are not my primary Babesia duncani treatment. Whereas if I have Babesia microti, I could either start with herbs or medications. So hopefully that sets the field a little bit for us. But again, I mean, go back here. This was known as of 2018 in the medical literature, and probably at least 5 to 10 years before clinically. But that's how all of the stuff we're talking about tonight, we've known for a long time that we need more information, but the data is really just starting to catch up. So if we speak for a minute about Bartonella, again, setting the stage, look at our top symptoms here. Our top symptoms are ones that look exactly like Lyme. They look exactly like babesiosis. Where we start to get a difference is we can start to have more of the tremors, and we can often see fingers wiggling. Transient muscle fasciculation might be, you see your arm or your leg or on your chest, you'll see a little movement of those muscles, and it might move. So when you hear Dr. Horowitz talk a lot about migratory joint pain being very specific to Lyme, he's added in migratory numbness and tingling or migratory peripheral neuropathy in Lyme, but it's also very telltale when you see numbness and tingling that migrates, or those fasciculations that move to different places in your body over time. I would be highly concerned about the Bartonella, something really to think about. Now, back when I had Lyme and babesiosis, my feet hurt like hell. I mean, it was insane. So the thing you have to think about with the foot and the heel pain, I've heard people say one is Lyme and one is Bartonella. I've got no clue. All I know is I never tested positive for Bartonella. I was never treated for it, and I've been asymptomatic for 10 years. My feet hurt really bad. I got treated for Lyme and babesiosis. My foot pain went away. So I don't know that anyone's actually sorted it out, but if you have foot and heel pain, especially that early morning, or you're on your feet and it's like absolutely stinging, it's way more than it should be, think Lyme or Bartonella. Now, if you have someone who has alcohol intolerance, especially new alcohol intolerance, think about Bartonella as well. That's another thing that pops up. Now, contrasting Bartonella to babesiosis, if we look, Babesia, I said, had bigger anxiety and depression, where Bartonella tends to be a little more mild. Now, I say tends because it's very hard to find somebody with only Bartonella and not Babesia, we can do it. But again, sometimes our symptoms are overlapping. Bartonella tends to cause more of these OCD type of symptoms, rage, kind of, the irritability and anger things you see. Now, also, you'll see in children acute regression. So their reading has gone back 4 and 5 years. Their handwriting has gone back really far overnight. And a lot of times it's like that. So a lot of that sounds like PANS and PANDAS, right? So we know that Bartonella can cause PANS and the autoimmune encephalitis in kids, but we also know that Bartonella by itself can treat that. And so part of the way to figure out the difference is, did Bartonella cause PANS? So now we have Bartonella and an autoimmune encephalitis, or is it just Bartonella as we start treatment? And if we treat Bartonella and symptoms quickly kind of calm down and we get ahead of it quickly, it's often more just Bartonella. Whereas if we're more long haul, lots of relapses, it could mean a little more PANS. I tend to treat people like they have both because I don't want to risk it. And it's actually part of most of our treatment protocols anyway, to be sort of broader spectrum, but it's something to think about. Some of the other things for Bartonella that we see are tick disorders, like a Tourette syndrome. You can have a shoulder twitch, you can have eye blinking. A lot of kids will get the eye blinking or the grunting under their mouth. Some of them will actually do almost like the bruxism, where you're getting the teeth grinding, but not at night when they're sleeping, but during the day. Pushing air forcibly through their nose, all kinds of weird noises, sometimes even hand flapping. That's looking like Bartonella-induced PANS to consider it. One other piece for Bartonella that you might want to think about is if you have one-sided symptoms, sometimes that's more Bartonella than something else. And again, because like when you go back here, I mean, a lot of this overlaps. Just think, if you have some of these that jump out that I'm highlighting for you in the milieu of all the other ones, that's where you start to go, hey, maybe I have Lyme and Bartonella, Lyme Babesia, Bartonella. The other one that most of us think about are these Bartonella striae, or tracts is what we're calling them now. In the past, we've thought because Bartonella leads to vasoproliferation, or growth of new blood vessels from existing ones into scar tissue, we said, hey, maybe this is Bartonella. We weren't able to prove that for a while, but in this one study last year, they were actually able to isolate Bartonella henselae from within these stretch marks. So now the question is, are these just from growth and gaining weight, or are these Bartonella marks? So one of the things that we would look at is Bartonella striae or tracts should blanch, because if they're caused by blood vessels, you should be able to push on them. Like if you took your fingernail right now, pushed on it, it would be white and it would turn to red. So if your stretch mark goes to red, goes from red to white, and then it fills back up, that may be more indicative of Bartonella, whereas other stretch marks might not change. Now, the thing with the Bartonella stretch marks is these can be new ones from Bartonella, or it could be that you have stretch marks from growth or surgery, which would be more of a scar, and you could have these blood vessels grow into it. So that's a way to think about Bartonella striae. The other thing is in Bartonella, we often will have swollen lymph nodes, whereas Lyme, you can, and they're also painful. In Lyme, you tend to have lymph nodes that are more painful, but without the swelling. And so I've talked to a lot of people who have really painful, really swollen lymph nodes when their Bartonella is rip-roaring or when it's flaring, whereas the Lyme, there's not as much of that swelling. So that might help you, when you're a practitioner, pick out those two differences. And then again, a lot of us have heard about the nodules on the outside of the leg or the inside of the arm. They may or may not be associated with Bartonella, but we certainly hear about them a lot. And when we treat Bartonella, a lot of these three phenomena go away. So that's our whirlwind beginning to kind of look at where we're at, set the baseline. We know co-infections are common. We just reviewed some of the basic symptoms. One of the reasons that Eric wanted me to talk here about co-infections is that we have a lot of new research. And so when we're talking about growing forms, which you'll hear a lot about nowadays talking about Lyme, we're also talking about a log growth, and that's this left side here. This is more rapid reproduction of the bugs. This is like where when you hear me talk about strep reproduces 30,000 times in 3 days, that's this right here. So strep reproduces out of control. It outstrips its nutritional supply, and it creates a lot of waste products. So it gets into a stationary form, and then it ultimately will burn out. So the acute infection burns itself out. Now, if we look at Bartonella, Babesia, they probably reproduce 2, 3, 4 times a day. Lyme once every 5 to 21 days, depending upon what research you read. The interesting thing is, so their log phase or their rapid growth phase is long, but then they get into this stationary phase. And this is like an extended holiday. This is almost like hibernation. If you watch any of those nature shows where they're walking around in Alaska on some Kodiak Island or whatever, and they're like looking for where to go hunting for the brown bears, the people on all the like mountain men and stuff, when you watch these, they're all like looking around. They're like, the Kodiak bear should be hibernating right now, but it might not be, right? So it might be coming out. And so this is almost like hibernation. And so when we look at what happened, and the reason I put this little blank here, Lyme and Bartonella know how to stick around for a really, really long time. So they don't typically get to this dead part. They just drag out the stationary form for a really long time. And now, if we look a little bit more specifically at the cells, you don't have to remember a lot of what's going on here. And obviously, this is not a spirochete. Bartonella does kind of look like this. But what you see is this is a normal, rapidly reproducing cell. And at the bottom, it's changed. It's kind of blown up. And a lot of these areas we see, you know, there's things that are truncated RNA, and all the RNA changes, DNA changes. We see that the membrane fluidity is different. We see that the cell is larger. And all this means is it's almost like that bear that got fatted up for the winter. It's ready to calm down and stick around for the long haul. And it's almost like a fire where we're smoking a fire, where we're trying to start a fire with wet leaves or wet wood. We're going to get a lot more smoke and irritation than we are real fire. Same thing here. This is going to be one of those persister forms that keeps it around. It's going to cause some inflammation. It's going to be a real pain in your rear end, but it's not likely to be causing major damage. It's more going to be the thing that drives you nuts. And if you notice down here, we only really heard about this around 2017. So that's interesting. Like, this is the first article I was able to find where they actually had a drawing of what went on in stationary phase. So this is all new. And this isn't even specifically Lyme and Bartonella. And now this is sort of a picture of a Bartonella biofilm, which I think many of us are familiar with talking about. Fat and polysaccharides that are protecting the organisms. Sometimes they need 200 to 500 times a normal antibiotic dose to penetrate. So I can't give you 200 pills of doxycycline twice a day. It's just not possible. But what's interesting is this Bartonella biofilm is actually different than that stationary form. And when you talk about Lyme disease and you're talking about round body forms, also different. So we have multiple different kinds of persisters. And where we had a real breakthrough in 2019 is where the researchers at Johns Hopkins first started to look at stationary form and different drugs that could help with Bartonella. And what you see here is there are 3 drugs that pretty much annihilated it right away: methylene blue, daptomycin, and pyravinium palmitoate. And so we don't really, daptomycin is an IV. Pyravinium palmitoate's not really available here, but we do have parental palmitoate, which I know some people have tried. And then when I changed this over here, I just looked at everybody who, if we bathed the organism in the antibiotic long enough, treated it. And then we add in these 3. But these 3 drugs at the top there are actually aminoglycosides, which can cause permanent hearing loss and kidney damage. So we use them, but we try not to use them too frequently. And we also see down at the bottom, clotrimazole comes into the picture here. So when we want to look at what would be clinically useful and easy to start working with, we see methylene blue and clotrimazole. And these are 2 medications that we have been using in the last year and a half or so that has made a massive difference helping people with persistent Bartonella start to get better. What's interesting about methylene blue is it's the world's first commercially available anti-malarial drug. And that was in the late 1800s. It's been shown to not be effective against Babesia microti. I've not found anybody who studied it against the Babesia duncani. And as we talk about it, you'll see I'm starting to think it might have some impact there. So then they started to look even deeper. And what they did is they said, hey, let's look at stationary again. Let's find some other drugs that work. And we see these ciprofloxacin, gentamicin, and nitrofurantoin helped. In this study, interestingly, in the follow-up study, methylene blue was not as good. But now, The other part is they started to combine things. Ciprofloxacin with either azithromycin or rifampin, or rifampin methylene blue and azithromycin methylene blue. And what you'll see is that they eradicated all the Bartonella stationary forms. So that's kind of interesting. We've kind of gone away from using as longer term Cipro because of the concerns about tendon rupture. But azithromycin and rifampin are probably drugs, if you've been around in Lyme for long enough, you've heard, as a pretty classic combination. You could also say chlorothromycin and rifampin. But it's kind of interesting we put those combinations together. What was really interesting to me is if I only do that classic combination of azith and rifampin, it doesn't work. Azithromycin disulfiram, add doxy, doesn't work. This one down here is Bactrim, also known as Septra. Rifampin and doxy, they did not work. So a lot of the ones that we're used to using for the log form do not work on that stationary form. The good news, though, is they're giving us more information on what to do. And they looked at it not just as stationary, but biofilm forms. We look across, and the longer we're leaving it in there, the methylene blue and the rifampin start to get into the biofilm by themselves for Bartonella, but the azithromycin, interestingly, does not. So it starts to make us think about some of our single drug protocols and which ones to choose. Now, it's really interesting. You take the same 4 combinations we showed against the stationary form. They don't do it after 2 days. They don't do it after 4 days, although methylene blue and azithromycin are getting close. But if we leave it in for a longer duration, 6 days, all of these will penetrate and get rid of the biofilm. So now this is directly applying these medications right on top of those. So the important thing to remember is our bodies aren't like that. So what this chart tells me is 2 days, not enough. 4 days, a little better, but not enough. 6 days, better. This is supporting evidence that we need duration of therapy in human beings. And yeah, that's just to remind me to say that. So just as a quick summary, these are our 4 runners. We've talked about them a bunch here to get started. Now, when I'm working with methylene blue, these are the dosages that I often will use. This is children above 8. If they're less, we can talk about that. I used to think we needed to use liposomal, but what we've really found is with the new research, the updated, we know that the methylene blue will penetrate into the biofilm itself. So we don't really have to worry about that too much, but that's some of the dosages we would use. Things to be aware of is you're going to get blue urine. Some people, it stains the toilet bowl, and the dysuria, which is actually spelled wrong, which is kind of cool. I'll fix that before I send you guys the slides. Is painful urination. There's a very small subset of people who will get painful urination. This is a medical dye that's used in kidney studies and for other things. Interestingly, one of the treatments is for reversing methemoglobinemia, which is actually one of the potential side effects of the dapsone protocols. So now if you're thinking like, hey, I'm doing Lyme persister protocol, maybe I'm doing doxy, rifampin, dapsone, and I'm like, well, I have Bartonella too, and I want to add in a persister drug on top of my rifampin doxy. I'm going to add in maybe methylene blue so it could not only help with my Bartonella persister, but counteract some of the potential side effects of my dapsone protocol. There's concern about serotonin syndrome. And this would be if you're on an SSRI, Zoloft, Prozac, Paxil, things of that nature, where you could have some side effects. I haven't seen it. My colleagues who use this as well haven't seen it, but I go over with my patients all of the potential side effects they might run into. The other thing is there's a potential with amphetamines like Adderall, even maybe Ritalin, of a thing called hypertensive crisis. Basically, your blood pressure is so high that you could give yourself a stroke. So I have not seen this, but it is possible. And with COVID, especially earlier in COVID, I chose not to combine it with amphetamines because a lot of people who needed medical care were not going to get the care that they needed. And I didn't think they would run into the ER if they really needed it. And that could be life-altering or ending. So we chose not to do that. And most people I know are also steering clear of that because it's just a pretty bad thing. We have other things. Where methylene blue really shines is when people have breathing issues and when people have cognitive issues. So people who have that air hunger that won't go away, and this is where I foreshadowed a minute ago, maybe Babesia duncani should be studied because this really does seem to help with that. Cognitive issues are also another place. I see a lot of people who have executive function issues, brain fog, can't work at work or school, where a couple months on methylene blue, massive changes in their cognitive abilities. So something to think about. The other one that I want to highlight is clotrimazole. Again, we can get it in, this is one that most people are used to as an oral dissolvable. We're doing it in capsules, so it bypasses the absorption in the esophagus. We want to get it down in the stomach and absorbed in the body. The best way I've seen to do it, both for compliance and clinical efficacy, is in a sustained release capsule. 20 milligrams does that. Really nice for adults. Kids, depending upon their size, we can use less. If they can't swallow pills, then we're left with our liquid, and we have to dose it more frequently. I use Pioneer Health Center in Vernon, Connecticut for most of this. And actually for the methylene blue, I'm either using Hopkinton Drug for liposomal or InfuServe America for their standard. And all these places are doing a really nice job for us. So if your practitioner needs to know where to get them, they can reach out to me or just go directly to those pharmacies. Now, clotrimazole, as I mentioned, is an anti-yeast agent. But what's really cool is it also is very good against aflatoxins. And many of you know, a lot of people who can't get better from their Bartonella, you've got a mycotoxin issue. One of our main ones that comes from Aspergillus is aflatoxin. Clotrimazole does a great job there. I haven't seen it studied in some of the others, and I suspect it works on other mycotoxins. The other place where it's amazing is I see that it really works in an immune modulatory way for things like PANS. So a lot of my PANS kids, I might go, hey, they're Bartonella. I want to jump to the big gun with the methylene blue. I will often go back here because it balances them out quicker. Their behavior gets under control better. They feel better about themselves quicker. That's been my clinical experience. And it's also a lot, easier for the kids because as much as it sounds cool to take an Instagram picture of your blue urine and post it, most of my young kids don't want their urine to be blue. And so we start off here. They start feeling better. They're a little more compliant. The other thing about the methylene blue is if they open the capsule, it is a dye that will be everywhere. So when our behaviors are more out of control, I start with sort of our more standard medicines that if we do happen to have a hissy fit and flip the pill somewhere, we're not going to have the house stained blue. This is the part that I love, right? Because we've just done 180 miles an hour through medications. And I think it's really important to know that that's where this research started. We started to find stationary and biofilm work done in Bartonella and Lyme persisters with medications. Now they're also in the last 18 months, actually in the last year for the herbs, all these herbs that we've been traditionally using in Lyme, Bartonella, and Babesia, we're starting to get much more fine-tuned in what we need. So as I mentioned earlier, loving Cryptolepis. I didn't really use it a lot in the past because I used a lot of artemisinin. But now we know that Cryptolepis is great for the stationary phase of Bartonella. In fact, it's probably the best herb available. And when it's compared against single antibiotics, including doxycycline, it works better. Now we look down, we see Jugulins nigra, which is black walnut hull. If you look through all these Lyme tinctures, anti-Lyme, anti-Bartonella, you'll see this in there. And it's hitting the Bartonella stationary phase. Japanese knotweed or Polygonum capsidatum is another one. These two have been around. Everybody's been talking about these forever. Now we know where to use them more specifically. And then 2 species of Scutellaria. If you take one thing out of our lecture, if you're going to freestyle one thing, Scutellaria, neuroprotective, cardioprotective, so brain protective, heart protective, liver protective, gut protective, anti-inflammatory, and kills Bartonella stationary forms, and some other things that I'll tell you about in a moment. And it's also really cool if you happen to have MRSA, the methylene-resistant Staph aureus, and you're trying to use something like amoxicillin, it's not going to work. If you put Scutellaria back in the mix, it starts to work again. So these herbs are broad spectrum, and they have many, many positive effects that some of our antibiotics don't have. And almost all of these are very pro-gut health, as opposed to our antibiotics, which happen to be the opposite in many cases. Now, the researchers at Johns Hopkins worked on that one. Then they also looked at growing and non-growing forms of Borrelia burgdorferi, or Lyme disease. And when we look at the stationary or non-growing form, check this out. Cryptolepis, black walnut hull, Japanese knotweed, right? Scutellaria. You can also add in Artemisia annua. So most of us are used to doing this for for babesiosis. But now we see that the Artemisia is actually helping us in other forms as well against Lyme disease. We see cat's claw. How many people have heard about cat's claw, right? Everybody with Lyme's got to be on it, right, Bill? And I got to tell you, it's hitting Borrelia burgdorferi. It's stationary form. And cystis, a lot of people are talking about cystis T. You can get this through BioPure. You can get a tincture or a tea. Very helpful. Lyme stationary form. Really interesting is when we look at the stationary form, some of these listed here are really commonly used. They don't work against the Lyme stationary form. But when you look at stevia, been studied for Lyme biofilm, so different type of persister. Andrograph is very commonly used, actually being used a ton right now in our COVID protective treatment protocols. Grapefruit seed extract has had mixed results against the Lyme round body form, but again, different than this. So we have evidence that we might want to start using some of these herbs here. We might go the top 3 or 4, maybe we add those, and we use stevia for the biofilm. We use grapefruit seed extract for the round body form. Monolaurin is another one. And what's interesting is LL37 is a potent peptide, works well in certain gastrointestinal things, didn't seem to really show much evidence against Lyme. Now, this is super cool. If you take that first chart, Artemisia, black walnut hull, and the cat's claw are not effective for the growing Borrelia. So a lot of us were using black walnut hull and the Uncaria, the cat's claw, for actively growing Lyme, when actually it was a better target for the stationary and non-growing form. So now we know how to start to target things better. We also know that if I use any of these 3, I probably need to give you coverage for that log growth, whether that's another herbal or an antibiotic. Again, great for stationary form. So now if we bring it together, we want to look at these herbs and we want to say, what can we do? And it's really cool. These top 3 are effective for the stationary forms of both Bartonella and Borrelia. And what's really super interesting to me is if I need an anti-inflammatory and your gut's not working, well, Scutellaria might be a good mix. If I think you also happen to have some babesiosis, I might start to think about Cryptolepis. Now, can I still use the Jugulans nigra or the black walnut hull? Well, for Bartonella, absolutely. For Lyme, I can, as long as I remember it's not for the growing phase, it's for stationary. So I'm going to want to make sure that I have something else in the mix. Same thing for Artemisia. Very commonly, people who work with me were on Artemisia, we're on Cryptolepis, we're on Scutellaria and black walnut hull, with or without antibiotics. But I know that I'm targeting with Artemisia, I'm going to be targeting babesiosis, and I'm going to be targeting Lyme stationary forms. So this is a nice way to kind of keep in your mind some of the extra things that can be added. And it also goes to show you why it's really important to work with a provider who knows this literature and is focused on it. Because what I was telling people a year and a half ago is a little bit different than what I'm telling them now. We're using similar treatments, but we're able to target them better. We know what we're addressing more because of that research. So, and sometimes you're like, hey, I'm taking my Uncaria, which is okay for the, Borrelia non-growing form, or for the stationary form, but not for that growing form. But everybody's throwing it in like it's great, the best thing ever for Lyme. I'm not saying it's not. All I'm saying is we want to know what we're addressing and what we're missing. Other little tips and tricks for folks. Crypto Plus is from Research Nutritional. It's really nice. Got Scutellaria, Lomatium, black walnut hull, one other thing. But it's a good way to start getting into Cryptolepis and black walnut hull in a combination. And artemisinin, I really like using liposomal. It's really good. I do pulse that as noted up here. Kids use lower doses. The other part of it, though, is Whole plant artemisia is really helpful as well, and you can go upwards of 500 milligrams total in a day. Again, working with a provider, there are some potential side effects to some of these things. Work with somebody who knows how to help you navigate it. I'm providing this because I want everyone to understand why we're mixing and matching so many things. Why 6 things instead of 2 things? Maybe why 15 things instead of 4 things? Other herbals that work really well for Bartonella and certainly ABART. When you look at babesiosis, Byron White has ABAB and AL for Lyme. Very, very good. I see a lot of kids and I see a lot of people who don't want alcohol-based tinctures, which Byron White are. So I use a lot of Beyond Balance. They have great Bartonella formulas, great Lyme formulas, love their Babesia formulas, absolutely love MC-BAB2 to go after Babesia Duncani, specially formulated for that. So it's really nice. And the thing is, with a lot of people using disulfiram these days for their Lyme protocols, this is glycerin-based. You can use it with disulfiram because it doesn't have any of that alcohol. Petunia is really good. You can titrate it if you get it from like Nutrimetics. Supreme Nutrition also has a great Petunia, which is in a powder form. You can also get Scutellaria from them and a bunch of other cool things. And other little tips and tricks. Some people use oregano oil. I don't use a lot of it, but it's another one that's out there. And then for Bartonella or any of the Des Bio kits, if you're stuck and your body doesn't seem to remember you're infected, use some of these homeopathic kits with the supervision of your provider. Lyme disease, babesiosis, Bartonella, they can really help people get unstuck. One of the places they really shine, I think, are Bartonella and Brucella. So just keep those in mind. I wanted to kind of round out this portion of the presentation and just talk about combinations that can be effective. One of the things I wondered, because most of us who have chronic infection don't have any log growth, maybe there's a benefit to just doing methylene blue and clotrimazole for our stationary Bartonella, or using some of those herbal protocols we just talked about. Because do we actually need to cover for rapidly reproducing bacteria if they've been in us for 4 or 5 years? I mean, for me, I got treated for 10 days and I didn't get another antimicrobial for 8 years. So did I really have log growth? Probably not. It was probably all stationary round body biofilm, those different persister forms. And then I started looking at, well, hey, we're doing a lot of work with disulfiram now for chronic Lyme. Maybe I can combine disulfiram with methylene blue and or clotrimazole. And I have a handful of people who are just a couple months into this protocol that we see on the screen. So what I'm suggesting is not that you abandon anything you're doing, but you and your practitioners start to get creative and start to look at what you actually have. Because do we really have log growth? I would think that over time, if we treat a lot and then the infection if you're getting better and better and better, that line that was at the top of the page would actually be lower and lower. And then if you flare or something big happens in your life and you have a huge rush of symptoms, that might be the time to add back in that log growth coverage. And maybe if you're doing the herbs, you can just cover it that way. And then my favorite topic of all is, what if we start combining these with some of the other herbals that we talked about? Maybe now we can start to have protocols that hit actively growing forms, if there are any, and really dial in on all these persister forms. We know that some of these herbs will penetrate the biofilms of Lyme and of Bartonella. I'm looking forward to seeing more research on that. And I can't wait to see when they start to look a little bit more at the round bodies. So this slide here is kind of like some of the really big players at the moment. This isn't to say that there aren't others. I mean, there's so many other herbs out there. And the way we use them is, and medications for that matter, is we use them based upon who you are as a unique individual. But these are ones that I would be thinking about, maybe reading about if you're interested in learning more about all of these. So that was kind of our part one. And that was like about 30% of my journey was using medicines and herbals to get better. The part I want to close with is thinking about how do we harness at least a third of our healing outcome, which is our placebo, and then do what I did, which is somehow get myself to 70% better before I even knew what I was doing. So I was an unconscious competent. I knew how to change my trajectory, but I didn't know what I was doing. Subsequently, I studied that, and my goal, my mission is to train other people to harness that power of the healing mechanism within them so that the combination of whatever they need, medication or herbal wise, and their mindset allows them to get full recovery. Because we just finished up our Truth About Lyme online conference this year, but it started out in the last 3 years as being a live conference where people were there. And during the day, we went skiing or hiking together. We did things together. My goal for everyone is that when you finish listening to this, you're empowered to take the next step towards complete healing. You don't have to want to ski or go hiking, but I want you to have a dream. And right now, just think about, what is the one thing you would love to do in your life that when you're healed? Not like be better from Lyme, but what the hell are you going to be doing when you're better? What is the thing? And it's not, decide what the what is, right? Like, I'm going to be playing with my kids or whatever, but then, or skiing but then think about the why. Why do you want that, right? Because we focus so much on how to get something done. So what I want you to do is leave the how to your body and your practitioner. Because if you just decide what you want, and more importantly, put the emotion behind it and get the why of what you want, your body will take off and start creating that for you. And then all this new information we just talked about, we can download that to your practitioner, and really all of that will come together for you. So the question is, when we have patterns, paradigm is a word that comes up often. And so my question is, are you a healthy person? Are you a healing person? Or are you a sick person? What is the paradigm? What is your typical pattern or model of thinking? When someone's asked you about yourself, how do you describe yourself? Because when I first got sick, I was describing myself as sick, and I didn't know what's going on. But then I was so frustrated by it. I was like, you know what? I'm doing all this stuff. I can't do it right now, but I was just like, I'm the person who's recovered. And then I became the healthy person. And with each step in my mind of changing my paradigm, I started to be better. And what's interesting is 95% of our brain activity is actually unconscious. So we're really unaware of it. We're on autopilot. And this is really great, because who the heck wants to learn how to walk every morning? Could you imagine if you woke up the next day, every day you had to relearn walking? But how did you learn walking? You had a pattern that you learned over time. So the same thing is with your health paradigm or your healing pattern. You've learned over time, whether you're a well person or a sick person, or a sick person who is becoming well. And so this is a place that I really I think is so important, because your pattern of walking, we can change. I can teach you how to change the way you walk. And right now I'm going to teach you a way to change the way you think, because so many of us with chronic infections experience pain. I mean, I literally, when I was laying on the floor for those first 4 days going through that massive Herxheimer, I was 23. My parents had to carry me to the bathroom. I was in so much pain, I could not move on my own. And then over the years, I had my chronic fatigue and fibromyalgia, and it just, everything hurt. When my wife and I first got married, if she laid her arm or elbow on my arm, I would feel a sharp stabbing pain go out my hand. And then it felt like Darth Vader shoved a lightsaber all the way back up my arm to the base of my head. And this is when the woman that I loved and just got married to touched me. Not a great way to start off a marriage, but I was like, but it was pain. And I got frustrated at times. And sometimes I fought it and I said, I should not be in pain. And when I say I'm not in pain, I create suffering. But I'm fighting the reality of the fact that I am in pain. I'm not saying that the pain, that we want to be in pain, but the pain is already there. So stop fighting it and saying it shouldn't be there, because it already is. Figure out a way to do something about your pain, or just find ways to learn from your pain and accept it. Accept that it's there. Don't accept that it's going to stay there, because I didn't accept that it was going to stay there. But in the moment, it's already there. You can't, if you want to fight it, your brain says it's not supposed to be here. That's where we create suffering. And what if we think about fatigue? Now, I just ran this conference. I was working my butt off for weeks and weeks and weeks up to it. Lots of extra hours. And some days I'd wake up tired. But if I said I'm not supposed to be tired, or I'm getting super stressed out and going, oh my God, I have so much to do. I'm going to be so tired. I'm not going to, then I'm fighting the reality. And I start to feel this thing we call exhaustion. How many of you listening have been chronically sick and started to fight the fact that you're sick? And when you start to really get pissed off at it and fight it, you get more tired, and then you're wiped out. There's a difference between fatigue because I exercised today and being completely and utterly emotionally wiped. You can learn to control those. So are we fighting reality? Okay, you can have a flare. You may feel something that's going on. But then the question is, are you creating a flare before it even happens? Oh my God, I'm in a flare. I'm freaking out. And then, something could even be worse than it is now. It's always going to go wrong. So question, the reality is I have a flare. Okay, let me check in and find out what's going on. Or am I over worrying about it? I just don't want you to add anything extra. Just like with our herbs, we learn how to combine them. So we give you the minimum with the maximum benefit. Same thing with our mindset. And emotion is an interesting word because it is literally our definition of our conscious awareness of our vibrational state. That's all it is. When you have an emotion, you're just aware of what's going on in your body, which I think Lyme disease taught me, and it was a brilliant gift. Because before I was aware, but not that aware. So the question I want you to ask yourself is, are you aware of the light signs, the little things, everything throughout the day that's minor? Or are you a person who has to whoa, I've overdone it now. I didn't listen to my body and there's a stop sign. Or maybe you're the person who pushes through even that and you don't slow down until you get hit by a Mack truck. I've seen thousands of patients and I know the vast majority of them, once they're sick, feel the feather. They feel every little thing. But what I'm saying is, on our way to healing, let's not do this, because the reason you got to that super sensitive part was we bypassed the stop sign and got hit by the truck. So as we start to heal, we want to start to feel those vibrations, understand what our body is doing and the signs it's giving us. Because sometimes it says push a little harder, and sometimes it says please don't push as hard. So one of the things we need to do is calm down, slow down a little bit and relax. And this is sometimes forced upon us when we get hit by that Mack truck, maybe called Lyme disease and Bartonella. But I want to teach you that we have the ability to change our state and get out of the stress. And you can do that with your breath. And it has a profound calming feeling on your system. Nasal breathing is important. Breathe in through your nose and into your belly. It'll slow down your breathing. And the beauty is this stimulates the nasal lymphatics, which is where a lot of the detoxification of our brain occur. It can help prevent PANS and PANDAS. But when we open up those nasal lymphatics, not only do we stimulate the brain in a positive way, but we get it to calm down and we get the detoxification to happen and our brain fog clears. It also stimulates nitric oxide, which decreases inflammation. This is exceptionally important when you're breathing through your nose slowly and taking your time breathing, not only in Lyme and Bartonella, but in COVID. We know that nitric oxide levels being high will block some of the inflammation pathways that COVID turns on. So if you want to do something to protect yourself from COVID and you want to recover from Lyme, one of the best things to do is square breathing. Real simple. Inhale for 3, hold for 3, exhale for 3, hold for 3. And then just keep doing that and slowly build up to 4 seconds, 5 seconds. It's not a number you want to build up to. It's what calms you down. Anything that will help you calm your breathing down will do it. Millions of different breathing exercises, whatever one you love. This is simple and free. Just find something where 5 to 15 minutes a day, you're calming your breathing down. Now we're going to supercharge this as we come into the finish line here. Andrew Carnegie, who used to be the richest man in the world back in the day, kind of like Bill Gates and Elon Musk and all those guys now. Any idea that's held in your mind, that's emphasized, and whether you fear it or you revere it, will begin at once to clothe itself in the most convenient and appropriate form available. So whatever you focus on, you'll bring more of. So if you're afraid of that flare, guess what? You're getting more flare. If you're afraid of being sick forever, guess what? You're more likely to be sick forever than the person who has the opposite opinion, which is, I'm going to be better someday. And I'm going to start to believe in that and feel that vibration. Because whenever you become completely absorbed in an emotional state, you are at that moment assuming the feeling of the state fulfilled. So the key here is when you see yourself as healthy, you don't have to believe it. Just think about it and feel the emotion of what you're going to be doing when you're healthy. This will stimulate your self-healing mechanisms, stimulate your immune system and will bring you to that next level of healing. And it'll bring into you the opportunities. And for me, the opportunities, yoga came into my life. Changing my diet came into my life. Many other things came. And ultimately, I was able to bring in the doctors that were able to diagnose and treat me after 8 years of not being able to find them. So I went from feeling like that to feeling like that. And that's what I would love for each and every one of you. So here's the exercise. Super easy. Get a piece of paper. Draw a horizontal line down it. On the left side, write down everything negative you feel about yourself, and especially what you feel about your health. Can't get better. I'm not worthy of getting better. I'm going to get better, then I'm going to relapse. It's healing is for somebody else. I've heard the stories, they're not for me. Whatever it is, write it on the left. Now on the right, write down the exact opposite. You don't even have to believe it, just write it down. It's the exact opposite of what you currently negatively believe about yourself. Take that negative part and rip it off. I would recommend shredding or burning it. This is actually me doing this a couple months ago when I was at a sticking point. Ceremoniously burn that stuff, all that negative stuff. And now what you're left over with is the new you. This is a new healing self-image that you've just created. It's the opposite of the things that are keeping you stuck. And like I said, you don't have to believe them. All you need to do to change that pattern of walking is practice walking. So if you want to change the pattern of healing and you're thinking about it, read these things out loud in the morning and at night and whenever you need a boost. Keep it in your pocket. And believe me, this stuff works so unbelievably well in healing and in all other aspects of your life. And it's fun to do with your kids. So the last piece here is there's got to be a lot of love in your life. Love will increase heart rate variability, which improves your immune function, resilience to stress. So after you get that square breathing going, start thinking about breathing into the heart while you're doing it. And then think about someone you love or something you love. Feel gratitude in your heart. Lyme disease brings down heart rate variability, which makes it easier for you to have your skip beats. It makes it easier for you to remain sick. So we're going to tell Lyme to go screw itself tonight. We're going to do the opposite. We're going to focus on gratitude in our heart for the purpose of, one, just having a great day, but more importantly, in this context, of improving our immune function, that Lyme is suppressed so that we can push Lyme, Bartonella out and bring healing in. So you guys can heal from Lyme and co-infections. Certainly, a couple of the programs I have are up there. Really excited to have been able to share that with you guys. And Bill, I think that's what I have on the main stage there.
Okay, great. Thank you very much, Dr. Tom. So we've got a couple of questions that have come in, but I encourage all of you now, if you're on the Zoom webinar, use the Q&A feature at the bottom of the screen. Ask your questions. If you're on Facebook, I'm also monitoring the comments on Facebook Live. I apologize. Facebook drives me insane most of the time. And I see there's 14 comments, yet I can only see 4 or 5. Despite everything I try, I can only see a few of the comments. So I apologize if I do not see your question on Facebook. Maybe ask it a second time. Maybe I'll see it. Yeah. So let's start with the questions that we have. First one, this actually came in ahead of time, Dr. Tom, and it's about bioresonance devices. Can you provide your insight on bioresonance devices such as Rife, AMP coil, etc., how they could be beneficial for vector-borne infections?
Yeah, I think it's an amazing question. As you may have been able to tell, I like harnessing my own vibration and the vibration of the universe on my own as much as I can, changing my mindset, getting myself in that healing frequency. When you look at things like Rife and some of these other Wave 1 and AMP coils, I think they have their place. Frequency is a real thing and it changes. So if you're at a place where you can afford one of them, you've done a lot of the foundational work, this can really be helpful. I think, and it depends. Like with Rife, there's certain machines like the GB4000 that are really good. There's certain frequencies that should be used. Anybody who's going to invest in one of these, the companies do a great job. I would connect with a person, a practitioner, or a well-educated patient who's gone through it and knows exactly what to use. There are companies out there that do a lot of affiliate stuff, which I'm completely okay with, but just be sure that the person you're getting your advice from of what frequencies to use is someone who's been out there and actually used it. Because a lot of times it's like, just like I'm in, it sounds great, it feels good, but I haven't for a week, but I haven't used it for a while. So a lot of them really work well. I know like Wave One and stuff that, Dr. Klinghardt and Dr. Schaffner have supported, and they're people that I know well, and, they're into that. I would just say, before you go spend them, that we can spend our energy one way or the other. We could spend it in our money energy to get one of those, or we could spend it putting our effort into creating a healing paradigm within ourselves. I'm always for one that if you can do it inside yourself, do it there first, because it's free. It costs you energy money as opposed to green money, but both can work and both have their place.
Very good. This next question is about, I believe it's about your practice. Can you diagnose virtually from any state? How can one be treated not living nearby? Are there any limitations?
That's an awesome question that I can kind of answer for myself and hopefully some of the other docs out there. We all, if you're a fully licensed physician, and across 50 states, that's an MD or a DO, nurse practitioner, PA. Some states license naturopaths and their licenses are a little different, so I won't comment. We need to have a license in the state where you are, where we see you. So in virtual terms, that means I need to have a license in the state where you live. Now, once I see you in my office in person in Connecticut, we can do virtual according to Connecticut rules for as long as I see fit. Usually I'll see people annually. With COVID, there's been a lot. I have licenses in additional states, temporary licenses. So that's been a lot more lax. You can also work with practitioners who do more health coaching. So they may be an MD who does health coaching. That's a completely different setup that doesn't have state boundaries. But for someone who can prescribe antibiotics, herbs, IVIG, diagnostic studies, that would be someone where they would need a license in your state. So if anybody's interested in seeing us, we try to keep our website posted. You can always reach out to the office. I'd highly encourage you to reach out to whatever practitioner you're interested in working with and say, hey, do you happen to have a license in my state, or is it something that would be easy for you to get?
Okay. Is it ever too late to treat Lyme and co-infections? Many have been ill for years with minimal treatment.
I had 10 days of treatment and 8 years of illness. And then we started the treatment after that. And it was 4.5 years, but I got completely better. I think that everybody can improve. The question of how much can you improve is kind of a difficult one. The thing that gives me tons of hope, Bill, is over the last 18 months, those studies that we flew through, and I just really wanted to share those, because the work that they're doing at like Tulane and Brown and especially Johns Hopkins is revolutionizing the way we address this. And there's private practitioners like Dr. Horwitz and Bransfield and Ligner who are diving into, all of us are doing it. But I've seen so many people where we had gotten good results. We saw the new research, we applied it, and their results took off. So for anyone who's stuck or hasn't seen it, you can almost always see a pretty darn good improvement. The question of whether you can get cured or not is more of an individual one. But I think there's a lot more hope now than there was even 18 months ago of these chronically sick people who just haven't made any changes really getting, forward and making huge progress. And I think, Bill, I was able to pull up Facebook. There's a question about like daptomycin, I think. And briefly, I've used a little bit of daptomycin. I haven't seen it really look like it does a lot with the Bartonella persisters easily. And during COVID, it's been a little harder to use IV, so I haven't really put it through its paces as much as maybe I would like. But at the same time, I'm finding those herbals and the methylene blue clotrimazole to really be making it so that I don't necessarily need to dive into daptomycin for that. And then, I don't know, did you see the question about herbs, supplements, and antibiotics and duration?
Yes, I do see that question. Yes.
Okay. Sorry if we hit that one.
You go right ahead. Yes. Please.
Yeah, I mean, results are kind of individual. I typically like to see some changes in the first 6 to 8 weeks. Sometimes it's longer. I've certainly had people on 3 antibiotics for 10 months, and I'm like squinting, going, I think they're getting better. I think they're getting better. And then they do. Typically, somewhere in the first 4 months, we should start to see something happening. That something may be good. That something may be a flare that's very consistent. Like, I think you have babesiosis. We treat you and your sweats are worse. Your bone pain is worse. So it has to really kind of line up. And I would say that herbs, supplements, and antibiotics, they all can work really fast, or they can take a long time. I was talking with Neil Nathan the other night on our conference, and he said when people come in and they've been sick for a little bit and they're like, hey, I got mold toxin, I got Bartonella. One of the things that the physician needs to really be aware of and honest with is say, hey, you know what? I hope you don't mind me really, and when actually we hit it off, because we're going to be friends for a while. I think that it's important for us to tell people about how long we think it's going to be, but for patients to understand, sometimes it took a while to get where you're at, and it might take a while to get where you're going. And I've talked to other practitioners like me that, hey, some people get better in 6 weeks. Some people take 3 or 5 years to really see the real benefit. So again, working with a practitioner who's skilled at doing this, has experience, and is also willing to tell you the truth, which I think was one of the things that took me the longest. I wanted everybody to get better in 6 months or less. But as we all know, like I've had people who I've gotten out of wheelchairs and 4 years later, they're done. Of course, in that story is 3 years to get out of a wheelchair. And then they're like, hallelujah, it didn't take 10 years. That was so fast. And I was like, really? 4 years is a long time. But it's your perspective of it. And so again, have your goal and really achieve it.
Okay, let's turn to a couple of questions on Zoom. Here's one. My feet burn, hurt, and spasm. Both are exponentially worse late in the day, not in the morning. Any thoughts on this?
A couple things. One is obviously, doing what we do, things like Bartonella and mold toxins kind of jump out as potentials. The other thing I found also is a lot of us focus on hydration to help us with these. I really like using some low dose electrolytes in my drinking water, whether you like them flavored and sweetened with stevia, or I just use straight up plain old matrix electrolytes from BioPure. I find that a lot of times it does help with that. My feet used to kill. So, and not so much burning, but just like excruciating pain. I would say, make sure you have someone take a look at Lyme, Babesia, Bartonella, look at, and if you're missing it, maybe look at an extended panel through Galaxy or IGeneX to really get some of these. Cause like I said, Borrelia miyamotoi, we used to think wasn't a human pathogen. We knew it was in the tick, but you're okay. And what we're finding now is we know we can test for a lot more of the Bartonellas. So a lot of times that's a place to look. Oh, and one other quick tip I just thought of, because I learned this with my mom. Ancient Minerals magnesium oil, which is really just magnesium in water. And there are many other ones, but I like that one a lot. A lot of times if you spray it on your feet and put your socks on, it'll help with stop the spasms.
That's a good tip. I've never heard that one.
Yeah, it's amazing. Like my mom's going to exercise class. And so people, when you get that at the end of the day, your feet are like this, I think hydration and magnesium. But the problem with magnesium is orally, it's not all that well absorbed. There are some more absorbable forms. The problem is we get to the right level, we can create diarrhea and before we get it. So why not just put it directly on the muscles in the feet, just like so give that one a shot as well.
Okay, good tip. Do you have any opinion about using low-dose naltrexone in treating chronic Lyme?
Yeah, I use a lot of low-dose naltrexone in adults and children. I've actually seen it be very immune modulatory and anti-inflammatory. I've seen some people who do okay, especially kids on IVIG for their PANDAS, but then it's not really holding them, but they've done it 12 or 24 doses. We add in LDN, maybe a little CBD oil, the over-the-counter version, but either one or both of those really seems to immune modulate a lot and allows, I've actually used LDN in people who can't get IVIG or want to get off of it because it's not holding them, and it works great. And as a general sort of immune modulator and cytokine reducer, thinking about COVID and Lyme inflammation, it works really well. Sometimes the theoretic optimal dose of 4.5 in adults is actually too high. And I find that some adults like 3.5, not that higher dose, and kids usually a little lower. But you play with it and work with somebody who has experience with it. Very good treatment for the right person.
Can Lyme co-infections cause hair loss in men, both men and women?
Yeah, I've actually seen two kinds of hair loss in both sexes. One is it can trigger alopecia, which is where you lose a lot of hair. I see that a lot less, and essentially start to go bald, or have major patches all over. That's less common, but that hormonal strain and what it can do in the follicles of the hair is one thing that co-infections could trigger. And the other part, which is much more common, our hair follicles have a certain amount of life to them before they spit the hair out. So your hair will grow. And as we all know, we lose about 100, 200 hairs a day. That's why hair comes out in the brush and in the shower. But when you're under stress, your hair follicles will actually start to have a lower life cycle, and they'll start to dump a bunch of hair. So people who sometimes go through huge flares, they will actually see massive amounts of hair falling out. Then we get it calmed down and it'll start to go back to normal. Unfortunately, now you have to let those little itty bitty hairs grow back. And very commonly it's going to be in the front hairline, so this has been my hairline forever, but if you had hair down here, you could literally get a bald spot like that, and then it would grow back, it wouldn't. So just think about it. If you're under that big stressor, it could potentially do that.
Is there any specific treatment just for the hair loss, or is it just treating the Lyme and the co-infections?
Yeah, I would treat the underlying cause. And this is a place where getting your mindset out of stress or just doing breathing to bring down the stress level, adding in that gratitude will minimize it, and I just want to be clear. We're not saying, it's like when I said pain and suffering, I'm not saying the pain or the Lyme or the co-infection isn't causing a really bad problem. I'm just saying, let's not make it worse. Let's take control of what we can control. And so stress is one of the main reasons we lose hair. So anything we can do to de-stress, including certain supplements and treating the underlying cause, are helpful.
Somebody is asking about your website. You may have mentioned it and they may have missed it. Can you maybe slowly say your website?
Yeah, absolutely. A couple places where we can give resources. Our main website is originsofhealth.com. So origins, plural, of health.com. And then if anybody's interested in checking out the conference that we just did, it's truthaboutlyme.com. And then also I have a sort of a home healing program that we take patients through called Leave Lyme Behind. And hopefully those will help.
Okay, and I'll make sure those get posted as comments to the Facebook video. All right. Somebody is asking, are you totally well now, or do you do some sort of maintenance program to stay well?
That's a cool question. The best I know, I have completely licked Lyme. I have not had a symptom in over 10 years. My mom always tells me don't burn the candle at both ends. I'm like, Mom, I've got 25 flames in between the two ends going at one time. I really pushed my body, tried to serve, do a lot of things where if I still had it, it would come out. So I believe that I'm 100% cured, no symptoms in a decade. Now, with that said, from a maintenance program, what I learned through Lyme is I do maintenance, like my diet, my mindfulness, meditation practice, my exercise practice. I eat so well. And I also do take some supplements. I don't take any specific Lyme ones. I make sure my D is up. I take some enzymes because I exercise a lot now. I do take a little mitochondrial support from time to time, and here and there a probiotic to just kind of do it. So I have a very lax maintenance program. 8 years ago, it was a little more intense as I was rebuilding from some of the antibiotics and antifungals I used. Once I got on the herbs, it made it a little easier. And yeah, so I think that everybody, should focus on, good, clean food, good, clean water. I'll tell you too, Bill, the one thing that made a massive difference when I was sick, I said, sleep when you're dead, because I slept for 4 hours, 12 hours, 14 hours. It made no difference. Then I got married and my wife's like, hey, do you want to hang out in bed because sleep is good? I'm like, well, sleep doesn't really help me. but I think you have a good idea there. Maybe I'll stay in bed longer, And I started to train myself to sleep more. And it took like 10 months and also the treatment of Lyme for me to wake up in the morning after 8.5 hours of sleep feeling rested. And so one of the things that's critical in my maintenance and critical in healing is focus on your sleep. And so tips, melatonin is great, breathing at bedtime, complex carbohydrate snack to help you stay asleep if you're waking up at 2, 3 in the morning. We want to dim ourselves. I actually turn off Wi-Fi at night. I put on blue blockers. And it's a little earlier for me than you, but my blue blockers are going on as soon as we're done. And the other part is if you're having a hard time going to bed, make yourself get up in the morning. I've even gone so far as in the winter, I use a thing called retimers at blue-green light that shine up into your eyes. They're out of Australia. And actually, if anybody cares to look at them, it's re-timer.com. And they gave me a discount code that is not an affiliate. I get nothing from it. But if you get DR Tom and you put in the code there, they'll give you like 20% off or something. But the idea is if you're having a hard time going to bed, make yourself get up in the morning, get your circadian rhythm back on track. This is huge in COVID. This is huge in Lyme. Your circadian rhythm, most of us need those 8 hours plus or minus a few minutes. And it's better to go to bed by 10 or 11 o'clock at night. So that's actually probably my sleep has been the biggest thing in my maintenance program. I do not compromise it. Maybe once every 4 or 5 months, I'll miss a night and get like 6, but that's really critical.
Well, here's a question I think goes along with that. Any diet or nutrition recommendations to support healing and an active lifestyle?
Yeah, 100,000%. I love this question, and it's something that I came to by accident, by learning to listen to my body. And then there's all this research on it. And I was actually talking to my friends, Terry Walls and Darren Engels the other day about how a lot of the healing books on Lyme, MS, or anything else, the diet is almost the same. And so what I recommend is a whole food, plant-based diet. And first, meaning we go in, we get real food as close to the planet as possible. We cook it ourselves. Yes, that means salad. Yes, that means planning ahead. If you're busy during the week, you might want to cook on the weekend. Then you add in whatever protein you want. So you can be a vegetarian, you can be a vegan if you try really damn hard and you really do it well. That's a little hard. I'm a recovering vegetarian because I did it pretty well, but I didn't feel well. I do better with meat, particularly red meat. But the idea being is most of our plate should be plants. Now, some people have issues with dairy. Some people have issues with gluten and corn. Keep an eye on those things. If you're not sure, remove them first for 6 to 8 weeks and then maybe add a little bit back in. I think that's really critical. So you should eat real food and lots of it. Lots of real green food and veg, not lots of like processed stuff. And can you go out once in a while? Did I have ice cream with my family celebrating something a couple of days ago? Absolutely. The sicker you are, the more strict I think you need to be. The less sick you are and the more healthy you are, you develop a resilience. One of the things I think is really important, Bill, when we're looking at healing from Lyme is check with your provider, see if a ketogenic diet may be right for you. I have seen, I believe, and I've even talked to Dave Asprey talking about the wave and all that other stuff about trying to research this, and we got to figure it out. I believe that when you do a ketogenic diet, your body, because we already know it's preferentially burning bad fats, fueling your brain with ketone, yet your brain is 60% fat. It's the fattest organ in our body. So our brain doesn't go bye-bye on keto, it actually gets better. So based on what I've seen in patients and myself, a ketogenic diet could help you burn through biofilm, get the inflammation down, get back on track. I really like a book called The Keto Reset Diet by Mark Sisson, because he takes you through steps. I would have wrote the book, except he did a great job and it doesn't need to be written. He takes you through a preparatory stage. And then if you pass a survey, a midterm exam, he'll give you the next step. The important part about that for everyone listening is if you've heard about carb flu or keto flu, it's real. And if you have Lyme and a huge biofilm load, it's going to be realer than real. If you can make it through it, more power to you, and you're going to feel amazing. But when you follow Mark's recommendations of slowly getting in there, it really makes a huge difference in your outcome because you can tolerate it better. Now, the last piece about the keto part is in Mark's book, he teaches you a couple different ways, once you become fat adapted, to cycle in and out of it to fit your lifestyle. So going back to what I said is when you're really sick, you got to be really close. You got to be more strict on your diet. Later on, as you develop that resiliency and you become adapted to eating healthy fats, green leafy vegetables, rainbow of vegetables, low glycemic index fruits, and smaller amounts of the appropriate proteins. And I'm not going to tell you to eat low fat proteins and lean meat. I love fat. I think it's one of the best brain foods. If your hormones suck, you need healthy fats. But then when you put all that together, then you can start to be more flexible as you heal, which is where I'm at now, but I was not at 13, 14 years ago.
Okay, great. We have a lot of questions left, but I'm afraid I'm not going to get to them all. I apologize to those that we're not going to get to them. Before I ask this last question, just to remind everybody, this presentation will be out on our Facebook page for, I'm not sure how long, a long time, in our videos section. We will be posting it onto our website, www.palyme.org, in a day or two, which links to our YouTube channel. So there's 3 places you could possibly find this presentation. And Dr. Tom, I'm going to thank you so much for being with us. And this is going to be the last question, and it's about mast cell disorder. For those with significant mast cell disorder on top of Lyme and mold, the chronic inflammatory response syndrome, and whose Lyme has been dealt with, anything in particular you would recommend for controlling mast cell?
Yeah, that's a great question. And we see a lot of it in response to Bartonella mycotoxin exposure triggering it, also Lyme in the gut. One of the things about mold toxins is they can essentially be an antibiotic to the good bacteria in your gut, which can lead to this. And also we get in that prime state with mast cells. Things to think about are, if you know, a lot of people with mast cell activation syndrome will have certain foods that really trigger them. When it gets really advanced, it's almost any food. So some of the things to think about is starting with quercetin about 30 minutes before your meals. You can look at 250 first starting 250 at bedtime, and then adding, every couple of days before meals. So you end up taking 250 half hour before meals and then at bedtime. You can go up to 500 milligrams. That can be really helpful. If you're still having symptoms, you can look at adding, and again, talk to your practitioner about this because it's very specific. Isoquercetin, Integrative Therapeutics makes a really good isoquercetin. There's a thing called Miraca, which is PEA. And so that's another one that can help balance things out. Some people find luteolin helps. And then also things like loratadine, which is Claritin, 10 milligrams once, if not twice a day, which is twice is double what you usually see recommended. There's a compound called ketotifen, which is most people know as an eye drop, but it's actually, you can get it orally. It's a histamine blocker, it's a leukotriene inhibitor, and a mast cell stabilizer. So that's a really good combination. That would require a prescription from a compounder. And then certainly some people use Singular. There's a company called US Enzymes that they're owned by Master Supplements, who makes Theralac. A lot of people know them in Lyme to protect your gut. They have a product called Sun Balance. It's got PEA, luteolin, and quercetin and some enzymes in it, which is really great. And that we often combine with a product called Immunozyme. And that's a really nice product that balance out the immune reaction in the gut. Those two together sometimes are the magic pill for us. So again, it's just about getting those histamine blockers in. You may need them longer and higher doses than you're typically used to. And then on top of that, if food really triggers you, we got to pull out the foods. Then we have to treat the mold, the Bartonella, and any other co-infections that we find. So.
Well, that was a great question and a great answer. And
I love the question.
It was a good question. Well, that brings us to the end, and I thank you for a great presentation, Dr. Tom. I really appreciate you being with us.
Greatly appreciate you guys having me. Thank you for all you do, and thanks everyone for listening.
Okay. Good night, everybody.